live in Hong Kong, the most basic medical coverage that you should have is VHIS, which stands for Voluntary Health Insurance Scheme. So this is an example of the standard VHIS plan. So what does it cover? It covers from the hospital charges item that is on the list from A to L. So let's go through each one by one. So A is room charge, which you can claim $750 per day, and B miscellaneous charges, which gives you $14,000 per year. We will go back to the miscellaneous charge afterwards. And C, attending doctor's visiting fee, which is $750 per day, and specialist fee, which is $4,300 per year. Intensive care or ICU is $3,500 per day. And surgeon's fee, so the maximum for the most complex surgery is $50,000 per surgery. And G anesthetic fee, which is 35% of whichever the surgery that you have done in the hospital. And also the same H operating theater charges or operating room charge, which is 35% of whichever the surgery that has been done in the hospital. And I prescribed the diagnostic imaging test, which gives you $20,000 per year. So this diagnostic imaging test under the category under category I includes like CT scan, PET scan, or MRI. So it doesn't include X-ray, ultrasound, mammography, or these kind of imaging tests. So these imaging tests can be claimed under the category miscellaneous charges here instead of fall under the category I. So J prescribed non-surgical cancer treatment. It gives you $80,000 per year maximum claim. So non-surgical cancer treatments usually means chemotherapy, radiotherapy, targeted therapy, or some other hormone therapy. So any cancer treatments are not surgical that you can claim under the category J here. And K, pre and post confinement outpatient care. So it gives you $580 per visit. You can only claim $3,000 maximum per year. And psychiatric treatments is $30,000 per year. And death benefit, $10,000 for this whole policy. So anything that adds up from A to L, so the total amount that you can claim per year is $420,000. This is a very good plan because it's cheap. It gives you fair amount of a coverage. The question is this really enough? So now I want to show you something. So this is a real hospital bill that's from a real patient. So she checked in the hospital on the July 12th, and she checked out the hospital on the same day. So she only stayed in the hospital for a couple hours, and it's a union hospital. So she incurred the outpatient consultation and the ward round and blah 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 and the other treatments. So how much she can claim under the standard VHIS? So if you look at the VHIS description or the standard plan description on the right, you can see the first she can claim is a room charge. So she has incurred the room charges of $1,100 as you can see from the bill on the left. And she can claim the maximum $750. So she wrote down $750 as a room coverage. And next is miscellaneous charges. So we'll go back to this later. So after that is a ward round. So she got charged of the $1,700 on the medical bill. And how much can she claim? So ward round is essentially attending doctor's visit. So that will fall under the category C. So she can claim $750 per day. So she has $1,700. So she can only write down the $750 as a maximum claim for the ward round. So she wrote it down. And next is specialist consultation, which she has incurred $3,400 on this bill. And the specialist fee on the right description, which is a category D. So the maximum is $4,300 per year. So she can claim the maximum amount of the $3,400 this time. So she wrote down that amount. So the next is ultrasound exam and laboratory tests and treatment procedure, admission service, consumable charges, and pharmaceutical charges, and another treatment procedure E. So if you take a look at the standard plan description on the right, you will find that none of these items fall under the from A to L. So where can she claim these charges? So she can only claim under the category B, which is miscellaneous charges, which is $14,000 per year. And all the yellow highlighted part on the bill, which is fall under the category B miscellaneous charge, it adds up to around $16,000, which goes beyond the $14,000 maximum claim. So she can only write down the $14,000 as a miscellaneous charge coverage for this bill. So the room charge, miscellaneous charge, ward round specialist, all these things adds up to $9,480. So this is a maximum amount that she can claim from this bill based on the standard VHIS plan. That means she has to pay $8,476 out of pocket for this bill, because if you use 26,000 minus 19,000, it gives you 8476. So only for one bill a couple of hours stay of the hospital, and she has to pay 8,476 out of pocket. And this is not the worst part. The worst part is she claimed 14,000 under the miscellaneous charge, which means that she doesn't have any room to claim under this category for the rest of the year. So she used up all this room. And that means anything that she incurred any hospital charges fall under this category, she has to pay out of pocket for the rest of her year, for the rest of the year. And also specialist charge, because she claimed the 3,400 already, so it gives her only 900 left that she can claim for the rest of the year. So if you already can see that only a couple hours she paid 3,400 for the specialist charge. It's quite pricey. So that means if she visits the hospital again and she incurred another specialist charge, and the $900, it doesn't really give her anything, any coverage. So that means she has to pay out of pocket for anything incurred in this category. So what's really included under the miscellaneous charges? Like I said, anything doesn't go from A to L. More specifically, there are certain items that actually fall under the miscellaneous charge. For example, road ambulance service fee from and to the hospital, anesthetic oxygen admin, and other admin charges. And most importantly, so the medicine and drug. These items are the most costly items. So these unfortunately fall under the miscellaneous charge category. And some other diagnostic imaging tests. So like I said, X-ray, ultrasound, mammography, all these types of imaging tests, it's gonna fall under the miscellaneous charge. And lab exam and reports, they are very expensive. Then you ask yourself again, okay, is this really enough, the standard VHIS plan? It's very cheap, my company pays for it. It gives me enough coverage. Most of the hospital fee actually fall under the miscellaneous charge, which is under category B here. And it only gives you $14,000 per year, which is very, very, very minimized. A lot of items you will fall under the specialist fee because specialists, they are very expensive. And the $4,300 per year is really, really not enough. And the imaging tests, the $20,000, I mean, this is only for what? Only for like CT scan, PET, and MRI. For all these cancer or like a very major illness imaging tests, the $20,000 it gives you per year. And any other like regular imaging test such as X-ray, ultrasound, it doesn't cover under this category. So you have to go back into the miscellaneous charge category, which is only $14,000. Standard VHIS, really. I mean, this miscellaneous charge is too limited. Most of the time, you end up to pay out of pocket for most of the hospital charges if you choose the standard VHIS plan only. This is an example of advanced VHIS plan. So what's the difference? What's the difference between the advanced version and the standard version? So the biggest difference between the two is the advanced version, everything is full cover. See, the full cover means that anything that you incurred, any amount, and no matter how much, it's gonna cover everything. Every penny of the thing of the fee that you paid, the insurance company is gonna cover it. So, which is quite different from the standard plan. It has a very limited amount that it offers. So, room charge, miscellaneous charge, attending doctor's fee, specialist intensive care, surgeon's fee, anesthetic fee, and operating room charge, and diagnostic imaging test, non-surgical cancer treatments, all full cover. Look at here, all full cover, how amazing it is. And the outpatient care is full cover, no cap. Here is 580, but this is full cover. So on top of the full cover, and the advanced plan adds up 1, 2, 3, 4, 5, 6. 6 additional benefits. What are the 6 additional benefits? So the first, it gives you the post day case procedure outpatient physiotherapy. So it doesn't have a physiotherapy under the standard package, but it gives you $3,000 and $6,000 up to $10,000 per year for this physiotherapy. And medical implants. As we know, medical implants are very expensive. The most amazing thing under this advanced plan is it gives you full cover of these implants, but it does have a specified items for the full coverage. And other non-specified items gives you $150,000 coverage per year. And also the third benefit, companion bed, home nursing, full cover. So some people, when they go home and they need they need a registered nurse to take care of them at home. So that nursing fee is gonna cover under this advanced plan. And emergency outpatient treatment, it's full cover as well. So the advanced plan has divided into 3 levels. The regular is at the most basic level, and enhanced the middle one, and the premier, which is the most expensive one. So the regular gives you 5 million coverage per year, and enhanced 10 million, and premier 20 million. And you have a choice to pay deductible like $0, $20,000, or $50,000. See, the good thing is if you already have a standard VHIS plan from your employer or from other sources that you already have a fair amount of the medical coverage. So you can choose the maximum deductible. which means that anything incurred above the 50 million or $50,000, that insurance will cover that. You can combine standard and the advanced together, which it gives you the maximum protection for your whole life. Advanced plan does give you a choice of choosing like the ward class. So the hospital room, you get to choose the semi-private or standard or regular room, which is amazing because most of the time if you choose semi-private, usually end up just by yourself. And the best part is the advanced VHIS, it's really not expensive. So if you choose the 50,000 deductible, you can only pay 3,900 for the whole year, which is almost the same, or maybe just a couple of like $100 more compared per month compared to the standard VHIS plan. I think this is definitely the best choice for your life and for your self protection.